Welcome back to Pharma Drops channel. Important MCQ series continues with the special notes. Today we are discussing part 2 from pharmacology questions. Question number 1. Acetazolamide is option A. Diuretic, B. Carbonic anhydrase inhibitor, C. Used in glaucoma, D. All of the above. Here is the answer, option D, all of the above. Acetazolamide is a sulfonamide derivative with diuretic, anti-glaucoma and anti-convulsant properties. Mechanism: inhibition of carbonic anhydrase enzyme present in the kidney. This will lead to increased excretion of hydrogen that further causes increased excretion of bicarbonate and cations. These changes leads to increased urine volume and decreased aqueous humor. Important side effects are metabolic acidosis due to increased bicarbonate excretion and hypokalemia due to increased cation excretion. Second question. The drug used as hematinic is option A. Ephedrine, B. Vitamin B12, C. Vitamin B6 and D. Vitamin C. Answer is option B. Vitamin B12. Ephedrine is a bronchodilator or nasal decongestant. Vitamin B12 is a hematinic. Vitamin B6 used for the peripheral neuropathy and vitamin C used in the treatment of scurvy. Question number 3. Antidote for malathion poisoning is option A. Vitamin K, B. Protamine sulfate, C. Nalorphine, D. Pralidoxime. Answer is option D. Pralidoxime. Vitamin K is antidote for warfarin, protamine sulfate, antidote for heparin, nalorphine and naloxone, antidote for morphine poisoning, and pralidoxime, antidote for pesticides including malathion. Fourth question. Antispasmodic used to relieve GI muscle spasm is option A. Edrophonium, B. Guanethidine, C. Bethanicol and D. Dicyclomine. Here the answer, option D. Dicyclomine. Edrophonium is the diagnostic agent for myasthenia gravis. Guanethidine is an antihypertensive agent. Bethanicol to treat urinary retention and dicyclomine is used to treat irritable bowel syndrome. Fifth question. The drug used as an analeptic is A. Nicotinamide, B. Amphetamine, C. Bemegrate, D. All of the above. Answer is option D. All of the above. The word analeptics are generally refers to respiratory analeptics. These are CNS stimulants. Mainly include these drugs: Bemegrate, amphetamine, nicotinamide, and dosacpram. An International Olympic Committee banned many of these drugs. Please remember the word ban. Sixth question. A drug used to promote pigment formation in vitiligo is option A. Soralen, B. Ditronol, C. Zinc oxide ointment, D. Ammoniated mercury ointment. Answer is option A. Soralen. Soralen is used for treatment of vitiligo, Ditronol for the treatment of psoriasis, zinc oxide ointment used for minor skin irritations such as burns, cuts and diaper rash, also as sunscreen, and ammoniated mercury ointment used for skin infections and psoriasis. Now we are going to next questions. Question number 7. Tropicamide is used as A. Meiotic, B. Mydriatic, C. Psychoplegic, and D. All of the above. Correct answer is option B. Mydriatic. Meiotic is an agent that produces excessive constriction of the pupil. Mydriatic is an agent that induces dilation of the pupil. Psychoplegic is an agent that causes the paralysis of the ciliary muscle of the eye, resulting in dilation of the pupil and paralysis of accommodation. Eighth question. Drugs used to prevent intravascular clotting of blood are called A. Coagulants, B. Anticoagulants, C. Statins, D. None of these. Answer is option B. Anticoagulants. Coagulants are a substance that causes blood to coagulate. Anticoagulants are medicines that prevent the blood from clotting as quickly. Statins are substances that promote hemostasis, that is prevent and stop bleeding, also called as anti-hemorrhagic agents. An antidote for heparin overdose is option A. Bile, option B. Atropine, option C. Protamine sulfate, and option D. Dicumarol. Answer is option C. Protamine sulfate. Protamine sulfate is a fairly strong basic protein that subsequently binds with a strong acidic heparin to produce a stable inactive complex. This is the mechanism of protamine sulfate. 10th question. Vasopressin is used in the treatment of A. Diabetes insipidus, B. Diabetes mellitus, C. Bronchial asthma, D. None of the above. Answer is option A. Diabetes insipidus. Diabetes insipidus is a disorder of certain water metabolism marked by intense thirst and heavy urination. This condition is caused by a hormonal abnormality and is not related to diabetes. Thank you for watching. Please subscribe my channel for more videos.